Hi again, I'm Mabel Jong, reporting live from the World Healthcare Congress here in Washington, D.C. Thanks for tuning in. And to continue our coverage of the panels that we are seeing today, we have Dr. Shawn Ryan in our studio, President and Chief Medical Officer at BrightView. Dr. Ryan, thanks for stopping by.
Thank you for having me.
And in Ohio, what are the rates? Are the rates of opioid dependence increasing in your state?
I would like to say I don't think they're increasing. So, we've had a fairly large transition from the prescription opioid problem to illicit drugs like heroin and fentanyl. And so many efforts going on. The governor, both past and current, are really putting in a lot of work, and their teams there. So I'm hopeful to say the rates aren't really increasing, and we're starting to see a decline in mortality as well.
It's really a big question when you're trying to address how to address this health crisis in the United States. But what are some things that BrightView is doing specifically?
Sure. So BrightView is a treatment organization really focused on a biopsychosocial or holistic model of treatment for all substances. And the key thing we do there, I say it's pretty simple actually. Answer the phone nicely, welcome people in and encourage them to come and get treatment, and then treat them well when they arrive. In addition to that, we do accept all insurances, which is pretty unique: Medicaid, Medicare, commercial, etc. We do a lot of community service related to our treatment sites and distribute a lot of naloxone or Narcan. So we really try to be, the best case provider using evidence-based methodologies for the patient. Make sure that we do serve the community to the best of our abilities.
Okay. Are there specific steps that BrightView adheres to in treating people who come through your door?
Sure. Yeah, so very importantly, we focus on medication-assisted treatment for opioid use disorder or medications for other substances when indicated and approved. But it's that holistic model that I mentioned with biopsychosocial. That means medical, including physicians, nurse practitioners, etc., the psychological therapy and whatnot through therapists, psychologists, and then we have social supports, which are very important. So it's that holistic biopsychosocial model that's unique to BrightView, in addition to the focus on evidence-based practice.
Is there any data to show that non-addictive pain medication is successful in helping wean people off of the more addictive substances?
Every person's journey is different, and we do try to focus on those kind of non-dependence creating medications for pain, because a lot of patients with opioid issues, opioid use disorder, have real pain. So we can't ignore that just because they developed an opioid dependence. So we do try to use those medications, neuropathic type medications, NSAIDs, etc. We also try to encourage other non-pharmacologic treatment of pain, mindfulness, meditation, yoga, physical therapy, things like that, acupuncture even. So it's all about ensuring that you develop an individualized treatment plan and make sure you treat the whole patient.
Is it an out-treatment facility?
Correct. We do outpatient primarily. We do partner with residential inpatient health systems in order to really kind of build that entire continuum of care that's necessary.
And is there data to show that your programs are working?
Sure. There's actually been decades of data to show that biopsychosocial model, including medication, is successful, and we're just working very hard against the stigma against medication, as well as the stigma against patients with the issues, to ensure that people seek out the right treatment model that we deliver at BrightView.
Great. And what is the message that you left with the panel for our attendees?
I think that we know what we should do. We have a lot of years of science that tell us what the right treatment models are. We need to deliver them more pervasively and in a more standard fashion. And I think that stigma is a huge problem. Stigma against mental health has been with us, for thousands of years as a species, and I think that we are making strides against it, recognizing how challenging it can be. But stigma really pervades the problem, and it does nothing but multiply the negativity for the patients and the families suffering the issues.
Okay, thank you so much for stopping by, Dr. Ryan. Really appreciate your time. And I'm Mabel Jong. Thanks for tuning in.